Hello everyone, I am Dr. Padmavati Surupaneni, dermatologist practicing in Hyderabad at Pragna Skin and Laser Clinic since 20 years. Today I am going to talk on melasma, unmasking the causes and treatments of melasma. Because melasma, we know we do in our day-to-day practice a lot of patients coming up with melasma. It will be emotionally distressing to the patients with that dark brown spots on their face, and it is difficult for us also to treat melasma, and the most difficult part is to maintain melasma after it reduces. So initially we used to think melasma is a problem with the melanocytes of the epidermal and dermal layer, but now we know like there are a lot of other factors contributing to melasma, not only the melanocytes, the fibroblasts and the vascular endothelial cells, mast cells, and a lot of inflammatory response, the hormonal issues, as well as the UV exposure. So I think it is time for us to discuss all these things, like what are the causes of melasma. And now, as we know that melasma is multifactorial, our treatment modalities also should change to counteract all these causative etiologies. So while the depigmenting agents stay the main first line of treatment for melasma, there are so many botanicals coming into action to treat all these etiologies of melasma. And then the oral medications, now we cannot leave our oral medications, the internal medications to treat and maintain melasma. And also the procedural treatments, now when and where we have to do procedures and how frequently we have to do to treat and maintain melasma. So on October 29th around 5 p.m. in the evening, we are going to discuss all these problems of melasma. Like the topic is unmasking the cause and treatments of melasma. So please do join me on that day at 5 p.m. And I would like to thank USV and DocMod for giving me this opportunity to participate in this very excellent academic session. Thank you.